Assalamualaikum warahmatullahi wabarakatuh. Thank you and fight to God for giving us healthy, so that we can meet in today online lectures first. Let's start these presentations by saying Bismillahirrahmanirrahim. Let me introduce myself. My name is Warsiah, NIM 211200054. I will present a primary report with the title AIR or acute respiratory infection. Is my presentation submaterial with concepts of definitions, anatomy, physiology, etiology, clinical manifestation, complications, supporting investigation, and management and nursing diagnosis. I will both explain definition. Acute respiratory infection is an infection caused by microorganisms in the upper respiratory tracts that do not function for gas extruding the nasal cavity, pharynx, and larynx, with symptoms such as diagnosis, pharyngitis or thorax, laryngitis, and influenza. Acute respiratory infection is an infectious disease of the upper or lower respiratory tract that can cause various kinds of disease, ranging from mild infection to severe and deadly disease, depending on the corrective pathogen, host factor, and environmental factor. Anatomy and physiology. Nose. The function of the nose is to inhale respiratory air, filter air from breathing air, and also place a nose in sound comments. Pharynx. The main function of the pharynx in the human respiratory system is as a digestive tract, which is to carry food into the esophagus. Larynx. The larynx or voice box is an organ in the necks of males that practice the trachea and its envelopments and sound production. The larynx is the respiratory tract that carries air to the trachea. Trachea, as a part that is able to transmit electricity when the swallowing process occurs, so that it will open the way for food, so that food enters the digestive system. Bronchus work as an air filter, but is only a secondary filter. Bronchiolus open as and place for delivery of CO2 and O2 to the alveolus. Alveoli, the place where the exchange of charge and O2 take place. Pleura, drink as a liquid or mucus so that it does not occur during inspirations and expirations. Etiology: Trichovirus, influenza virus, coronavirus, H. pneumonia, H. influenzae, and characteristics. Risk factor: age, chronic disease, smoking and cold smoke, exports and chemicals adverse, immunocompromised patients. Clinical manifestations of air symptoms that are generally experienced by subversives: nasal congestion and runny nose, 3 coughs without pain, with fever, short throat, malhydrins, rapid breathing of dysfunctions breathings, loose color of the skin due to lack of oxygen, symptoms of sinusitis such as physical pains, runny nose, and fevers. Complication. Sinusitis is inflammations of the sinus walls. Sinus are small crevices that are connected to the edge outer strokes areas in the skull. Sinus are located at the base of the brachial bone. It's inside of the cage bone structures both sides of the brains of the nose and within the eyes. Pharyngitis is inflammation of the thorax of pharynx. This condition is also known as strep throat, which is characterized by the sore throat, its change and infection stalling. Bronchitis is inflammation of the main respiratory tracts of bronchi. Bronchi function as channels that carry air to and from the lungs. A person suffering from bronchitis is usually characterized by the appearance of a congested system that lasts for a week or more. Causes of the Eustachian's tube. A blocked Eustachian's tube gives symptoms of diarrhea and infection can penetrate directly into the child's HR and causes acute otitis media. Supporting examination, the usually follow-up examinations are examination of the culture or culture of gram or swabs. The results obtained are bacterial culture plus according to the type of grams. Nasal ball examination, differential count, interstitial country sedimentation rate accompanied by the presence of leukocytes and might also be accompanied by the presence of thrombocytopenia. Trace X-ray in management, nursing management, maintain good nutrition intake, maintain personal and environmental hygiene, maintain direct account with patients with air, encourage rest and let's 8 hours per day. If thread is sacred in the nose, clean it using a clean handshake. Medical management. Overcoming help with paracetamol drug therapy or by giving compress in children. Paracetamol is given for time every 6 hours for 2 days. The worth of administering the drug is adjusted to the doses recommended by the doctor and other drug therapy. Notably, the convenience for colds and chunks. Diagnosis: infective airway related to increased amounts of secret. Hypertension is associated with an increase in body temperature. Acute pain related to inflammation to the mucous membranes of the pharynx and tonsil. Infective breathing patterns related to obstructive bronchial response to bronchial walls. Imbalanced nutrition list and needs with decreased apparent due to painful swallowing. Anxieties related to disease prognosis, progressions, and changes in health status. Alright, just the presentations of the material I can convey. I end. Wassalamualaikum warahmatullahi wabarakatuh.